Hello, everyone. Welcome to another webinar from the Steps Forward Innovation Academy. Today, we'll be discussing optimizing onboarding in healthcare. Our experts are here to outline our toolkit designed to help you develop a formal onboarding process that engages all key stakeholders and ensures new physicians and non-physician providers feel supported as they ramp up their clinical work. Please note that this webinar is for informational purposes only and is believed to be current and accurate at the time of posting. Please consult a professional advisor for specific medical, legal, financial, or other advice. References and links to third parties do not constitute endorsement or warranty by the AMA. And just so that you folks are familiar with your experience today as an attendee, if you're joining us on Zoom, you will see a dark menu bar either at the bottom or the top of your window. There you can access a selection of resources related to this webinar, including links to our onboarding optimization toolkit and today's slides. There is also a link to stepsforward.org, where you can find our past toolkits, podcasts, and webinars. If you don't see those options, select the three-dot More button to access the resources and the Q&A. If you're joining us on YouTube or LinkedIn, welcome. You can follow the link in the description to join us here on Zoom, access the resources, and ask questions for our speakers to answer. After the webinar concludes today, you will be able to claim 0.75 continuing medical education credit hours. You can follow the link in the Resources tab to the AMA Ed Hub and claim the credit there. Also in the resources, you will see a link to our upcoming webinars. Check out the programming we have planned for the rest of the year and register all in one step. We'll remind you of all this at the end, but for now, I would like to introduce today's speakers. Joining us are Jenn Balchunas, Director of Clinical Growth at UNC Physicians Network, and Dr. Chen, our Physician Director of Practice Sustainability here at the AMA. Dr. Chen, I'll pass the microphone right over to you.
Thank you so much, Alec. My name is Chen. I am a radiation oncologist by training, practiced for 13 years in a number of different practice settings, one of them being a medical director at a community hospital. But I joined the AMA stepping back from clinical practice in 2023 to join the AMA in leading some work around private practice sustainability, business of medicine, but more recently for career development. So we really believe that onboarding is a very important key piece of career development, helping physicians and the practices that they're entering sort of smooth the way for them to have a fruitful and successful career within that institution. And so we created this toolkit. Jenn was the primary author. I took part as well. And so without further ado, we'll get into some of the details of this toolkit and have a great discussion with Jenn about some of the ins and outs of how to optimize your onboarding process. And so first off, we wanted to get through some learning objectives that we hope you can take away from today's talk. The first is to identify the benefits of implementing a formal onboarding process. And I think the key is formal. We'll show that that is very useful. The second thing is to describe how to engage physicians and advanced practice clinicians, and we'll refer to them as advanced practice clinicians or APCs. Those could be nurse practitioners, physician assistants, et cetera. And how to engage them in while they're ramping up their clinical work. Finally, we'll explore some checklists for before, during, and after a physician or clinician's first day. Next slide, please. And I'll turn it over to Jenn to introduce herself and also to talk about some of these steps that we have outlined in our toolkit.
Thanks so much, Dr. Chen. I really appreciate being here today. My name is Jenn Balchunas. I am a nurse by trade. Many moons ago, I never thought I'd be leaving the clinical side of practice. And 13 years ago, I left and really kind of dived into this world. And so the last 4.5 years, I've really spent in onboarding. And so I'm excited to share this with what we've learned over the last 4 years. It's made a huge difference for our physicians and clinicians. And I hope you can take something away today from these steps that you guys can implement. It's made a huge impact for us. So the steps we're really going to review today are making the case to leadership for onboarding time and resources, the importance of gathering those key stakeholders together to build your toolkit, prepare for the new physician using a pre-orientation checklist, orienting that new physician to the checklist, and then this is one of the biggest things that we do is providing a clinical ramp-up time to see patients, providing robust EHR support, and then offering that peer connection and mentorship and access to stakeholders. That is another piece that I think makes people feel very connected when they join your organization. So I'm going to turn it back over to Dr. Chen to share more about step one, which is, of course, making the case to leadership.
And Alec, if you don't mind going back to that last slide, we'll linger on that, the one with steps 1 through 4. So this first step is we need to make the case to leadership, and it could be, and I want to address that, there could be large healthcare institutions, but this also applies to smaller or independent practice as well. If you're a physician owner, you're also the leadership of that practice. And so you may need to make the case to yourself to allow for that onboarding time and resources, because I know it takes away from, the busy clinic day. But that being said, we know that from a recent study that was published in 2024 from the Association of Advancing Physician and Provider Recruitment, the AAPPR, that 56% of all physicians and other healthcare professionals who've had a positive onboarding experience, they reported a high job satisfaction rate, versus compared to 19% of those having positive experiences or positive job satisfaction when they had negative onboarding. So obviously, it sounds like it contributes greatly to high job satisfaction. We know that job satisfaction may lead to burnout and intent to leave the organization. And we also know that it is for recruiting of a physician, that can be very expensive and can cost the practice 2 to 3 times a physician's annual salary. So, we know as physicians that if we can take that first step, and that first step is fruitful and is feels like it's a step in the right direction, that it really paves that path for us to be successful in our careers. But if that first step is a misstep or is not as well thought out as we would like, then dissatisfaction can occur quite early. And so making that case to leadership, not only for the physician and clinician well-being side of things, but also to decrease turnover and the costs that are associated with turnover and further recruitment. And we're not even talking about lost revenue when there's a gap in a position that's not filled. If you all, as the audience members, need more tools to try to make that case to leadership, especially when it comes to finances, we do have a link in our toolkit to the AMA's Organizational Cost of Physician Burnout Calculator, and that can help you calculate how much or estimate how much it could cost your organization to replace a physician or clinician if you don't have those numbers readily available to you. And so I'll ask Jenn this question. From your organization leadership's perspective, why was it so important to establish a formal onboarding program at UNC?
Yeah, I think I was in a really lucky position because they came to me asking, could I work on creating this? I think in most cases, people are going to leadership advocating for some sort of process to be put in place. They came to me because they had seen gaps in the process. They were getting feedback directly from our new physicians and clinicians. And so I think there's a couple of reasons why they thought it was important. One was the feedback, right? New teammates joining our clinics who didn't feel supported in some cases arrived to clinic and people didn't seem like they were supposed to know they were coming, right? And that doesn't make us feel welcome when we show up to the new clinic and people are like, oh, I didn't realize you'd be here today. We witnessed and received feedback that not having a formal ramp up process in place was really leaving our new physicians and clinicians not feeling supported. Setting somebody up to see 14 patients on day one is not going to get them in the place that we need them to be. And then reducing the waste and closing gaps. We're a huge network across the entire state. And so realizing there were pockets of work happening across the state, but people didn't realize what others were doing was going to allow us to kind of reduce the redundancy and eliminate any gaps in that situation. So, um, yeah.
Thanks for that insight. And I also wanted to touch upon what the AAPPR said about a formal process. And they said that in one survey, 73% of clinicians reported satisfaction with their onboarding if they had undergone a formal process, and we're underlining formal, as compared to only 34% of those that didn't, they were dissatisfied. So I think that that really highlights that formality of the process. I think for a physician coming in or a clinician coming in, I think it may even play a part in recruitment if the recruiting team can show that there's a great process that's in place for a physician to start or a clinician to start. That really speaks to the culture of the institution or the practice in really highlighting and underlining the import of physician and clinician wellness. And so with that, I'll go on to step two, if you don't mind going there. Thank you, Alec. Um, we talk about gathering key stakeholders, and I think we want to talk about buckets or groups of people, and knowing that a lot of folks, especially in small and independent practice, wear many different hats. So you may be the physician and you're the recruiter, for instance, or you may be the practice manager and you do credentialing. You don't have this list of key stakeholders that we have on the screen right now. Each of those do not have to be individual people. You can wear different hats just as long as you think about each specific role and who plays that role, whether it's many people like a team, or one person handling two or three. So I just wanted to highlight that, especially I know we had a question that was posed in registration. How do I apply this to rural practices? And I know that rural practices can be resource strapped. And so just as long as folks are really keying in on each specific role, it doesn't matter that you may not have one particular person for one particular role. So, Jen, I just wanted to talk to you about your experience as to the key inputs in your institution in creating this onboarding program. Who did you have to bring together, especially when we're talking about operational clinical leaders, as well as practice and operations managers?
Yeah, I think what you said is incredibly important because it's not really so much as long as you can bring to the table the process that you're participating in, whether you're filling one hat or two hats in your clinic, that's the piece that is crucial, like understanding your piece of the process and how that applies to everybody else. And so I'm somebody who basically, if you ask me to do something, I'm always going to say, sure, we can do it. And this was a situation where I really had no idea what I was stepping into. We had our first meeting and I immediately realized like, okay, we're missing people. We need talent acquisition, which in our organization is separate from HR. And so it took one or two meetings to really get everybody at the table. For us, it was recruitment, credentialing, HR, talent acquisition, somebody from finance, legal, operations. We have directors and practice managers who are involved in the process. We needed everybody at the table. And then as we got into it, realizing, okay, in some regions, maybe the HR person is a completely different person than what we have in the triangle or central region. And so pulling them in as well. And it took several meetings, I would say it probably took once or twice a month meetings for a good 6 months. And then we began to meet on a monthly cadence. But we talked through every single step of the process. We literally started at the top to say, what do you even have to do to ask recruitment to post a position? We started as if no one knew what anybody else was doing. And that was incredibly helpful because what I really learned is everybody had created a process, right? This is in any situation, whether you're a single clinic, part of an organization, everybody has to keep moving in healthcare. And when you're recruiting, even more so, we can't really slow the process down. We're trying to fill that gap. So everybody had created a process. It just wasn't to a point that everybody else knew what was happening, right? And so if I didn't know when identity proofing happened, then there was a problem with e-prescribing. And so all these little pieces began to lay out. And so once we really had a process that identified what everybody was doing, we actually found there were several things that we needed legal or HR to weigh in on. So we got everybody in the room, we talked through every step of the process. And then if there were things that needed to be done between the next meeting, we would have one-off meetings with those smaller groups. And so it allowed us to remove the variation, right? And maybe what I ask a new hire was different from another region, pulled it all back together to say there's only one process going forward. And this is the process that HR, legal, finance, operation has signed off on. And we're all going to be moving in that same direction, no matter where we work in the organization. So um, I think I'd ask you, why is it important to also involve the teams associated with recruitment in the creation of an onboarding process for you all at your organization?
So I think that as a physician, one of the first touch points to a new organization that we have is a recruiter. Either it's a in-house recruiter or maybe a third-party recruiter, or it could be a physician colleague that's reached out to us. And so that trust is built there because that's our first contact. And so if that recruiter or recruiting person is able to understand the process of onboarding, it helps that recruiter pave the path for that physician to sort of let them know, hey, this is coming up. This is what you should expect in this time frame. And it's very helpful, especially upfront when you're doing your initial credentialing and your application process, that we know what timelines we need to hold by, especially to get documents in these kinds of things, to get our licensures up to date. And so if the recruiter knows that, there's a place for the new physician or the new clinician to reach out to. We won't know who's in the medical staff office yet. We won't know who's, in the HR department yet. We just know who that recruiting person is, especially right at the beginning. And so I think that that's really important that that recruiter at least understand and take part in this gathering of key stakeholders in the process. Not only that, I think it really creates that, again, I think we're underlining the culture of the entirety of the process. We want to be collaborative, and it shows that physician or new clinician that this organization really cares. And I think that that is the right first step to take. And so that I believe is the biggest reason why to include those recruiting folks into the conversation really early on. Great. Um, so I think we'll go to the next step, which I think is a favorite of a lot of physicians and clinicians alike, is we love checklists. And obviously this is a very busy slide. These are just key elements that you can think about while you're preparing your pre-orientation checklist. So what do we need to do before that new physician starts at an institution, a practice, a small independent practice? What do we need to have for them? And so on the left-hand side, we see the things that are sort of logistic. And on the right-hand side, there are a lot of things that need to take place even before a physician or clinician starts in clinic. And so, we'll go through some of these things, but the first thing that I want to ask you, Jen, is on this list, are there things that are routinely overlooked by practices when you're onboarding, especially in that pre-orientation phase or before that physician starts? When you were creating the program at UNC, I know you looked at a lot of differing regional or practice processes. what was the one or two or even three things that you thought were missing in a lot of these places that you thought were mission critical?
Yeah, I think the welcome sign, as basic as that sounds, was something that, I think we take for granted that you've been hired and people want you to be here. And making those small gestures goes a very long way. Sending an email ahead of time just to say, we'll see you on Monday. We're going to meet you here. Here's what your first week will look like. Those are things that go a long way to helping people feel welcome. And then the other piece I would say that was a typical miss was getting that EHR elbow support. So our onboarding team provides that EHR support. Our schedules are incredibly busy. You can imagine how many people we onboard. So we had a notice period that we would say, can you please request this within 21 to 30 days? That wasn't happening. And it makes a huge difference to provide this at the elbow onboarding support. And I think that was probably a routine miss. And we've really kind of tightened that gap up as we've moved forward.
That's great to hear, and that welcome sign I think still underlines again that culture that we're trying to create
Yes.
for the incoming team member. I'll talk a little bit about personal experience and quote unquote on pre-orientation onboarding. I was signing up for some locums tenens shifts at an institution, and they had just undergone some reorganization. And I was asked to fill out the same form three different times, and this was the same application three different times. I cannot tell you how frustrating it was for me to have to do that. This probably took me 30, 40 minutes of time because it wasn't all at once. I was asked for it over a period of three different time periods. And so, having that checklist that everybody can reference on that onboarding and recruitment team to know that, oh, it's already been checked off, I think is very, very helpful. And so, again, checklist. I think it helps us not forget things in our process. And so, moving from this pre-orientation checklist, which is very, very important, I think the next step we have is to produce an orientation checklist. So what happens when a new physician or clinician enters the building? What needs to happen for that physician or clinician that day one and the subsequent days for them to get into the mix, if you will, of seeing patients in the clinic. And so I'll ask you, Jen, in your experience, what do you think are the most important aspects of this orientation checklist? And again, these are high level ideas. Each institution may have a little bit different take on things, but at your institution, what do you think are the most important aspects for that orientation first day or early days of a physician being on site?
Yeah, it really is hard to kind of pick a couple. I will say both checklists, these are just some of the things that are on there. We're really trying to look at it from beginning to end. When you look at this kind of orientation checklist, there's a section for the practice manager, there's a section for the medical director, for the physician or clinician. And so it's really meant to lay out over several weeks, probably that first month, I would say. I think some of the most important things that we're doing through this checklist is one, connecting that clinician with key resources, physician compliance, really connecting them to the people who are the experts when it comes to documentation and coding and billing, getting those questions answered. I think providing time for that physician or clinician to learn about scope of practice for our certified medical assistants, our licensed teammates, it's incredibly important, and it really sets them up as a care team, I think, for success. If I understand what expectations are being defined from the very beginning for my care team member, right, that allows us to work together better as a team. When you join an organization, right, we've got policies, procedures, standing orders, protocols. We really try to begin to incorporate that from day one. So once they finish their UNC LMS modules, they do their EHR training. There's typically a down period between I'm I'm done with my online training. I'm not ready 100% to see patients. Maybe I'm going to go shadow with somebody. We have a whole section of very helpful things such as scope of practice, controlled substance agreements, med refill protocol. What are those key things you use in your practice or your organization that you want them to be aware of as they're practicing in your organization? We really try to spend time, I think, diving into those from the very beginning through this orientation checklist.
I appreciate. Oh, go ahead.
No, no, you go ahead.
I appreciate that you said, if you have a little bit of downtime, you can sort of use that to do other things that are extraordinarily useful on this checklist. So I think that that's one thing that I would call out is that if you do have this checklist, let's say somebody is able to finish up, uh, let's say they're very, very well versed in the EHR that orientation already has, then they can go on and do something else on the checklist, which I think is very efficient for both the clinician, physician, and the organization. I also want to highlight that, Jen, I know you provided us a couple of sample checklists from UNC for steps 3, the pre-orientation checklist, as well as the orientation checklist. So I think that the listeners, if you don't know where to start, these are wonderful samples to sort of try to get ideas from and try to get your process sort of in place and your checklist in place. So yeah, let's move on to clinical wrap-up time. Again, I think this is a busy slide, but Jen, would you like to talk a little bit more about this?
Yeah, and I think, what you said is so important about time, right? And I think in my previous role, we would go out and try to work with new physicians and clinicians, and you'd come in on day 2 of them being with the organization, and they're supposed to hit the ground running, right? We have to provide them time for all of these things, as hard as that is, right? Because if you're working in primary care, there's a huge access issue, right? And so we really want to get people ramped up as fast as possible, but we've got to provide that time to get them to the point that they can even see patients successfully. So I think I would ask you when it comes to ramp up, why is it so important for physicians and other clinicians to have that ramp up time?
So I think it comes down to not starting off with sort of behind. And what I mean by that is I think that if we're still trying to figure out an organization and we're trying to figure out who to talk to call for IT support or who I need to help me set up my security clearances for the computer systems, and this happened to me at a locums gig that I just had. It's going to be hard for me to see 20 patients, and so if I have the appropriate clinical ramp up time, then maybe I'm seeing 10 patients, and I do have some time to get into the system. I didn't have in this example, I didn't have Epic access. Uh, for the first half day of clinic that I had. And so I had time to catch up because I only had a half day of clinic. So that I think is really important because if you start off and you're already into pajama time, let's say you're already working, after 5, trying to complete your charts, it's going to be hard to catch up if you have full clinic days thereafter, each and every day. And so I think that that is a very, very quick road to burnout for most physicians and clinicians. So I think clinical ramp up time, and I think we've heard this time and time again, is essential to this process. We know that, especially for small and independent practice, it's time lost for patient access, but I think in the long run, it's a long-term investment in both physician and clinician satisfaction, well-being, as well as dollars and cents because you're not going to have that
Mhm.
physician or clinician turnover. So, I think on this slide we've talked about there can be different timeframes for folks that are just coming out of training versus seasoned physicians. So I knew how to use Epic already, and so I might not need as much Epic training as somebody that's, a Cerner user, for instance. And so I think that needs to be called out. Are there any other thoughts on clinical ramp-up time in your eyes?
Yeah, I think one thing I would say is we've spent a lot of time working on a process for fresh out of school APCs, and I think that has been a game changer. They have an even slower ramp up, and no matter how long you have been working in the EHR or are fresh out of school or not, we're really encouraging our practice managers to kind of have a weekly check-in with the med director and the new physician and clinician just to say, how are things going? We have this detailed ramp up, but for fresh out of school APCs, we're really seeing that conversation is helping. And maybe on Monday, we're supposed to add a patient to each morning and afternoon session. And that new clinician says, like, I'm ready for one in the morning and not one in the afternoon. Giving them that time to have that conversation, it goes a long way. Maybe we get by Wednesday of next week and that clinician says, like, okay, I'm ready, add that patient in the afternoon. But it allows them to have some input into that conversation, which makes them feel fit, cared for, welcomed, valued. What we've seen is by doing that, we do eventually get there, right? We catch up to what that ramp up is supposed to be. But most cases, they will then say, like, okay, I'm actually ready. And they will ramp up even quicker because they've had that longer period to kind of get into the groove, if that makes sense. But we have found our ramp up to really be an invaluable process for us.
Yeah, and I like that you highlighted the flexibility. I think that really, really is key. Um, I know we're running a little short on time, so we'll go to EHR support, robust EHR support, and I think this is a topic near and dear to your heart, Jen. So, what does EHR support look like at your institution?
Yeah. This is might be the thing I am most proud of that has been accomplished from this team in the last 4 years. We morph this, we change it, we learn probably, I would say, monthly what's working well, what's not. We remain very flexible. The reason this works is because it's relationship based and we meet that new physician or clinician where they're at. And that's really, truly what makes this work. I also have huge leadership buy-in. I mean, they truly believe in this team and the work, and that makes a huge difference. So when you see on here day 1, 2, and 5, we really mean when they start seeing patients. Typically for us, that's going to be Thursday, Friday of week 1. Sometimes it's Wednesday, sometimes it's the following Monday. We work with that practice manager to coordinate and schedule that date. So we will come out day 1 of seeing patients, day 2 of seeing patients. We will stand right next to them. We will build their note templates, their preference list, teach them how to navigate a visit, how to drop your charges, customize them to make them as efficient as possible. And then as we round back on day 5, day 45, all 14 to 30, we come back multiple times. During that time, we're building on the foundation that we're beginning to teach them. Our goal is to build them this really solid foundation. And we all know that in basket does not look the same on day 5 as it does on 30 or day 90. So we've learned that if we come back and we continue to give information in small pieces, they can build off of that. I now have a robust in basket by day 90, the things that I'm going to teach you and how to create quick actions or smart phrases, how to move through those messages is very different at day 90. In the very beginning, I just need you to see your patient, close your note, and come back. I need you to come back the next day and see patients. I don't need you to know how to create smart phrases and build a note template and make your own preference list. Those are things we're going to teach you over time when you've built that comfort and the confidence. We also really incorporate our quality measures. We want to make sure they're learning the UNC way out of the gate. Any protocols, procedures, scope of practice, anything we can incorporate into what we teach them for the EHR allows them to feel like it's one less thing we're asking them to do outside of a visit. And that's part of the goal as well, is to kind of make it an all-encompassing. We're going to teach you the workflow and the EHR at the same time. And that, I mean, it's been a huge win. We have great feedback. We kind of round it out at day 90 by sending them an overview of their data, tells them where they spend the most of the time in the EHR, how much they spend after hours, on weekends, where we can help them. We make suggestions of where we can help them, and then we offer them one more in-person session to come out and support them. So this is near and dear to my heart. The team is amazing, and they have done just tremendous work in this area. It's just huge. And I think I would turn it back to you and end it by saying, in addition to all of this, why is it important from a physician perspective to connect that, make that peer connection and mentorship throughout the onboarding program?
Yeah, so I think we've heard time and time again, and this is something that resonates with me, that knowing someone who has gone through this before I have as a mentor, and learning from them the trials and tribulations and how to get things done in patient care, I think is invaluable. And so oftentimes we try to do this organically, but I think it's extraordinarily helpful in an onboarding process to have a formal process to introduce um, physicians and clinicians to a mentor or a peer for that connection. And this can take the form of somebody else in a different department, but it also is important for that physician or clinician to have touch bases with their direct clinical lead, whether it be a medical director or a department chair, and just to set expectations and really, again, build upon that culture that, hey, my medical director is hearing me, is meeting with me, is doing the thing he or she needs or they need to help me become successful in my position and my tenure here at this institution. So I think it's really important to feel that connection and to know where to go within the institution, as well as potentially navigating, institution politics. I think is extraordinarily helpful to get resources that a physician or clinician needs to help them become successful. So I think that is, we'll wrap up there with the sort of the conversational or didactic portion of our talk. So let's field some questions. I know we have a couple of minutes. And so folks that are listening in, if you want to put those in the chat, we can go through those, but I think that there are a couple of questions that came in during the registration process. And so I will, we talked a little bit about how the toolkit can apply to smaller rural hospitals. I think that's a great question. I think, smaller rural hospitals, as we know, are oftentimes resource strapped. But if you just think about that formal process, you may not have to have every single piece, but just think about it formally. That shows that you care to any incoming physician or clinician. And also, if that physician or clinician is questioning, hey, what about this step? Let's say you aren't able to provide clinical wrap-up time. Perhaps you can come into a dialogue with that physician and clinician and come to a mutually agreed upon solution to that problematic spot. And that may be something that you can learn to implement even more in your onboarding program. So I think that that's a great question. And a second question that came through was, what's a good turnaround time to convey to applicants? And I'll ask that to you, Jen.
I would say 60 to 90 days. Credentialing used to really have a very hard 90 days for us. And I think because we've gotten so many pieces in place, they've backed that up to about 60 days. So I do think 60 to 90 days is probably a realistic expectation.
Yeah, and I do want to highlight that's in North Carolina and
Mhm.
at UNC. And so there, I did a podcast with a couple of folks as well in a um, centralized verification office in Indiana and Kentucky. And so that we know can vary from state to state, especially with licensure and from
Mhm.
institution to institution. So if you're interested in hearing more about that, I don't know, Alec, if you can put that in the chat, but there's a podcast episode specifically on licensure and credentialing that we have through Steps Forward. Um, Shameless plug for a podcast. But that being said, another question that we got was, how can we integrate new physicians on our team of 14 providers to foster collaboration and retention early on? And Jen, I'll turn that question to you.
I mean, I really think it's some of the simple things, right? Of sending a welcome email, let them know what they can expect this first week or two. We schedule a weekly touch point with the med director. That allows them to feel connected, having that welcome sign. Sometimes I think it's the little things that go a much longer way than something big. I think making them feel heard, making them feel valued, allowing them to say, like, today was great or tomorrow was not so great. Could I see one less tomorrow? In the long run, it will be worth it. And I think when I first started in this role, maybe we weren't there 100%, right? To say, like, let's slow down a little bit, it will be worth it. But now, after 4 years of seeing what this does and, the feedback we get, just people feeling so supported, I think it goes a really long way.
Great. Thank you for that answer. I think that that's absolutely correct. That culture that we want to provide for them is critical. We have some other questions that have come through. I'm going to lump two together. One question says there are companies that have features helping onboarding. For example, having a place where staff members can log in and see what's on the checklist and go through those tasks on the onboarding team to track their progress. Any suggestions on that? That's one question. And the other question is thoughts on using AI for support tools, especially around EHR. I think those two we can lump together and say, okay, let's say we don't have a full out team like you do, Jen. We're a smaller practice. How, what are your thoughts about, third party companies that can help out or AI tools that can help out?
Yeah, so one I could say for AI, we now use UNC is working with a bridge. So all of our clinicians in the outpatient setting have a bridge. So we teach that as part of our onboarding process. If they don't have it as like they don't have access to a bridge yet, we still build the note templates and preference list. But a bridge has become part of our onboarding process. Some physicians or clinicians prefer to use it for some visit types and not others. So we just incorporate all of that. I will say for using third party companies, like we honestly use an old school Excel and we have a really nice checklist that we built out ourselves. And we email that to that new clinician, the practice manager, the med director. So on day one, recruitment kind of sends their welcome email. They introduce our onboarding team and we pick it up from there. And so we email that so everybody is aware of what the goals are of the next month, what's on that checklist. We've looked at other vendors and utilizing, fancier tools, but honestly, this works for us. We have over 180 clinics right now. We're getting ready to add 85 more. And I still feel very confident in the process we have in place using the tools that we do.
Yeah, I think that's awesome. I think you don't need fancy
Yeah.
tools per se. That being said, I think maybe if you're a small or independent practice, you may not have the bandwidth to generate all these things and track all these things. And so I think the first two steps will inform that third party company choice. I believe that if you have the right stakeholders in the room,
Mhm.
they may be able to come up with criteria for what you need in a third party company. And then those stakeholders can come back time and time again to evaluate and make sure that third party company is doing what you want them to do, what you need them to do. So I think those are, number one, it doesn't have to be fancy, technologically advanced. And number two, if you need to go that route, um, uh, get your stakeholders in a room and try to figure out what you need from that third party. A couple more questions. Um, how can you identify those that may have problems with the onboarding before they get to that problem point? For example, slow to ramp up. Not great to bring them in and then find the fit is wrong.
Yeah,
Uh,
that's a hard one.
yeah, I,
That's
I,
a
I
hard one.
yeah, I think it's, coming back and getting feedback quickly, I think on a
Mhm.
routine cadence, we talk about in the toolkit, that may be the fastest you're going to get to understand the issues. And then, Jen, you talked about being flexible. So is there
Yeah.
anything else you would like to add?
We have executive medical directors and medical directors in our clinic. And I think, because we have such great relationships with the operational team, it's very apparent usually pretty quickly when we go out to work with somebody if we call them red flags, right? If there's like some red flags here, I've been out 3 times and we still can't find the problem list. We have that kind of relationship that I can go to that executive medical director, the medical director, and the practice manager and say, like, please be aware. We also track everything we do. We have our own checklist we work off. Every physician and clinician is being taught the same information. We track all of our hours. So it's an easy way to say, okay, I've spent 50 hours with this person and the average we spend with somebody is 25. So building that relationship with those operational and clinical leaders, I think is really important in that as well.
Thank you for walking us through that. And finally, I think I want to touch upon this one. This is a more specific question. It says, my practice has 14 providers and we have an extensive onboarding process. That's great. However, we are in the process of credentialing a licensed clinical social worker who is under an associate license, and we want to ensure that we have everything together in the beginning rather than learning things later. Would
Mhm.
you have any suggestions?
So I would say we don't typically onboard our social workers because they're in a different department. But I think what I would say is the checklist would still be helpful, right? We still need to make sure they're credentialed. We still need to get them EHR training. I think you could still start with the checklist to make sure you're not missing any steps. There'll be things that don't apply to them at all. Uh, but we don't typically onboard our social workers, so I don't know if I could share anything else on that.
Yeah, I think that that's good first principles. I don't think we can delve into that specifically, but I think those are good first principles. And with that, I would like, and there's a question about where the checklists are. Those are in the body of the toolkit. They're linked out, so that's where you can find them. But I would really like to thank Jen for participating in our discussion today, and hopefully this has been fruitful for our attendees. So thank you for attending, and let's wrap it up. And I think I'll leave it with this. The formal process is very important, and come back to it time and time again to improve upon it, so that you can have a great onboarding process.
Thank you.
Awesome. Thank you both so much for your time and expertise today. I have a few more things to wrap us up here, so just give me another minute of your time. When we conclude today, you will see our feedback survey. Please take the time to answer just the 2 questions there. Your responses help guide our upcoming programming to deliver webinars you want to see, such as the one you saw today. This recording will be available for you to review on demand with the link used to join today, including access to today's slides and recommended resources. Of note, I believe we did successfully track down the podcast that Dr. Chen referenced. I did send it to you all in the chat. I also added it to that resources tab. If it's not the one that you think he was referencing, that's okay. From there, you could easily find all of our other podcasts, and you can go to any service such as Apple Podcasts or Spotify, wherever you get your podcasts. We try to be everywhere for you. In terms of webinars, our next webinar is next week, is under 2 weeks from today, focused upon key behavioral health CPT codes in practice. Our expert speakers will share insights on the latest key behavioral health related CPT codes that physicians and care teams can use when providing screening, treatment, or preventative services. They'll explore real-world examples on how those codes can support more timely, whole-person care for patients. If you'd like to attend, you can register now by following the link in the Resources tab and register there in one step. And finally, if you're looking for something in person to do, a little more interactive through AMA Steps Forward, we would like to invite all attendees to join us for our next Saving Time Practice Innovation Bootcamp here in Chicago at headquarters in September. This 2-day in-person boot camp is specifically designed for clinical and operational change agents looking to eliminate unnecessary work and free up more time to focus on patient care. We have lots of our staff and authors there of these toolkits who are able to really get into the weeds with you. So if you want a chance to meet with great people who are putting together our amazing work, this is your chance to do it. If you have interest in attending, you can follow the link in the resources tab as well. For any additional resources, guidance, and guidance to support your physician and staff, including those focused upon onboarding optimization, please visit stepsforward.org. And thank you all so much for joining us. We hope to see you again soon.
Record.